It's coronavirus lockdown after registering a record number of new cases. Nearly 100 infections were recorded on Monday, with the capital Havana and a neighbouring province worst hit. Authorities have suspended public transport and ordered people to wear masks. Russia has declared itself the first country to register a vaccine against coronavirus. President Putin made the announcement, saying that one of his daughters had already received an injection. The Russian vaccine was approved after less than 2 months of human trials, raising concerns about its safety. Meanwhile, the number of confirmed COVID-19 cases around the world has surpassed 20 million. More than half of those are in the United States, India and Brazil. Health officials believe the number of people infected is likely to be much higher, as many countries, especially in the developing world, have only limited testing. And scientists say nearly 40% of infected people show no symptoms. Well, let's get more on this from John Campbell. He's a health analyst, nurse and educator from Carlisle in England. Welcome to DW. 20 million cases worldwide, a number that has doubled in just 6 weeks. So is the rate of infection around the world increasing?
Well, there's increasing number of people becoming infected, yes. As there's more people that are infected, they're going to pass the virus on to more people. So we do get this exponential growth where the acceleration in the number of cases is actually accelerating. The greater the number, the faster the rate of growth. And I think that's what we're starting to see in quite a few places now. We've seen this for some time in the United States, and as you rightly say, Brazil and India and Russia, and South Africa, unfortunately, not far behind as well. So increasing cases in all of these areas. Now, there has been some levelling off that's been made a lot of. There's been a lot of publicity about the amount of levelling off in new cases in the United States, for example. But this is a levelling off in the number of new cases that are increasing. So the actual cases, there's still a lot of cases there, but the rate of increase is not quite as high as it was. But globally, we are seeing many cases. And as you rightly said there, Phil, this is really only the tip of the iceberg. The real number of cases are going to be perhaps 10 times higher than this. We know this from serological studies in the UK. The Office for National Statistics goes out and takes a representative sample of people. And they've estimated about 2.8 to 3 million people in the UK have actually had COVID-19 infection.
Right.
And that's way higher than the official numbers.
We see in these numbers around the world, the US, Brazil and India accounting for half of all cases. Why? Is there something beyond there just being more Brazilians, Russians and Americans?
Yes, very good question. I think a lot of it is the way this pandemic started off. How there was a small sort of cluster of cases and how they were dealt with in the early stages. So in a sense, we're paying the consequences now for what was done probably way back in January or February. So, for example, to take an extreme case, New Zealand had a small number of cases around about that time, but were able to isolate them very effectively. Whereas in the United States, there was probably a degree of denial about how serious this virus was and how transmissible it was and what sort of burden of morbidity and mortality it could carry. India and Brazil are probably slightly different. In India and Brazil, although they're on different continents, you do have quite a lot of common problems there. You have relatively poor healthcare infrastructure. You have a lot of poor people living in fairly close environments, perhaps several people or even a family living in one room. You also have quite a lot of multi-generational families as well. So there's a lot of close contact transmission. Right. And that allows the number of cases to increase quite rapidly in those countries.
I just want to get your reaction to today's news that Russia claims to have approved a coronavirus vaccine. How reassured should we be by that news? Briefly, if you wouldn't mind.
Yes, I think the answer is not very reassured. I mean, the UK and Europe and the United States has been going absolutely flat out on this vaccine development since the coronavirus pandemic became an issue. And we are still have only a few sample vaccines at what we call phase 3 clinical trials. I think there's 4 vaccines now at phase 3 clinical trials. And this means that we vaccinate a large number of people with the vaccine, a large number of people with the placebo, and then we see how that happens. Now, there simply has not been enough weeks and months have passed to do such a study in Russia. It just hasn't been the time.
It's perhaps been rushed in Russia, if I can characterise your answer that way.
Well, I don't think there's any question about that. The sort of the level of reassurance and validity and safety testing and efficacy testing that we would expect in Western countries for a new drug or new vaccine to come online, there simply has not been the time to do that.
Good talking to you. That's very clear. Thank you so much, John Campbell, health analyst and educator. Well, the corona